Okay. Here's a class activity that we didn't have an opportunity to get to, but think about it if you would while you're at home reviewing this. What are some of the fears that patients and families have concerning nursing home placement? I picked some pretty, not so pretty slides to show here, perhaps. Um, you know, what are some of the concerns that we have? What are we so afraid of about nursing home placement? And then think about what role nurses can play in helping to reduce the impact of institutionalization on the older adult and his or her family. So look at these images, and gerontological nurses face many, many challenges when they're working with this population. One of the most common problems among older adults is that diseases become very difficult to diagnose. Um, Older adults' symptoms are very often attributed. The older adults themselves attribute some of their symptoms to the fact that they're getting older. And they also self treat by altering their functional status. An example might be an older adult who is beginning to have more significant memory problems than they have had in the past. Instead of reporting these symptoms to the healthcare provider, the individual may make some compensatory changes in the home environment to help correct for these increases in memory problems and lapses. For example, the individual may, make little more notes for themselves. Uh, Adhere to their routine more stringently. Seek help from their partner when they're, if they forget things. Hide or cover up perhaps lapses in their memory. Whereas if they reported the increases in memory issues to the healthcare provider, perhaps the individual would benefit from some early medical treatment, perhaps for some early dementia. We don't know for sure, but the chances are that, if caught early, maybe some sort of medical intervention would be beneficial. An example of an atypical presentation of a disease where the older adult doesn't have the same types of symptoms as a younger adult might have would be, for example, a acute appendicitis. Okay, typically that's going to be a very acute localized abdominal pain reported by the adult. The older adult may not experience localized abdominal discomfort at all. And they may not have any symptoms actually until a perforated bowel, excuse me, not bowel, we're talking about appendicitis, until a perforated appendix happens. Older adults have been known to experience myocardial infarcts without having pain. Um, Urinary tracts or pneumonia. Again, instead of typical symptoms of infection that are seen in younger persons, for example, um, fever is one. The individual older adult with UTI or pneumonia may demonstrate confusion. They may start stumbling and fall. They may experience more functional impairment and have a normal temperature to boot. So sometimes finding out exactly what's going on with our older adults it becomes more challenging. Okay, again, we talked about function being so important. We need to assess the older adult's functional status. And whenever we're doing any kind of assessment with an older adult, it's important for us to remember that we need to um, ease any of their fears or anxieties that they might have. They don't want us as health professionals to open up a can of worms, so to speak. Kind of like, leave well enough alone. Don't ask me all these questions because I might say something that I might give you the wrong answer, and we might find out that there's something else wrong with me and I already have enough. So, ease their fear and anxiety. Make sure that their primary needs are met before you begin your assessment. Do they need to use the bathroom? Are they in a lot of pain right now? Make sure that basic needs are met before you begin your assessment. Make sure your older adult is using any assistive devices that they have. Are their glasses on, and are their hearing aids in and turned on and operating properly? If you're going to assess an individual's ambulation and ability to get out of a chair and they use a cane or a walker, make sure that cane or walker is available for them. Try to keep the assessment down in terms of short increments so that you avoid unnecessary fatigue with the older adult. And be sure to allow time. The older adult is going to most older adults will be able to answer your questions, but it may take them a little bit longer to do so. So allow time for the assessment and the interview so that you're not rushing the older adult. SPICES, SPICES, is an acronym for an assessment tool that you will be asked to use and apply in all of your adult patients that you care for this semester in the clinical setting. And again, it's found on that consultjerryrn.org website. And the acronym stands for sleep, problems eating, incontinence, confusion, any evidence of falls, and skin breakdown. And when we're managing our time and caring for multiple patients in a clinical setting environment, it's important for us to get the most amount of information that we can sometimes in a very short period of time so that we can, prioritize and start dealing with those problems that might be creating the most challenges for our adults. So SPICES is a good overall assessment tool to get us focused on some of the common problems that our older adults might be having. When we're doing our assessment on older adults, it's important for us to stress that the focus, or it's important for us to remember as nurses, that the focus of our assessment is to determine what interventions might be appropriate for this particular individual to maintain and enhance their functional abilities. It's all about function. All right, the nursing management of older adults. Okay, we're going to apply our nursing process to this population just like we do all others. We're going to come up with priority nursing diagnoses. These nursing diagnoses are typically the same as they are for younger adults. However, the etiology and defining characteristics are often age specific or age related and unique to the older adult population. There's a table in Lewis, table 5-12, that lists some of the common nursing diagnoses associated with age-related physiologic and psychological changes as well. When we're planning interventions for the older adult population, we want to make sure that we're able to identify their strengths and their abilities. Focus on what's working well for them. What can they do? And then we're also going to want to include any of the caregivers that are in the picture, whether it's siblings, whether it's a spouse, whether it's adult children, friends. Include the caregiver when we're in the planning phase of managing the health care for the older adult patient. And of course, as always, we individualize our care. We want to modify our approach as necessary based upon their cognitive functioning. We certainly want to continue to promote health and wellness with the older adult, and we want to make sure that the older adult continues to strive to increase the percentage of healthy behaviors that they have and practice, while also using the appropriate preventive services for the older adult. Older adults make up approximately 50% of the hospital market today in the United States. They tend to have longer length of stays, between 7.8 or 5.4 days on an average, And they have higher rates of readmission. And a readmission is defined as a readmission to the acute care setting within 30 days of discharge. Many of the older adults who are admitted into the acute care setting are experiencing some form of cognitive impairment. Could be related to a dementia, could be related to their current disease process, but we do need to consider that as well when we are caring for this population. We have to remember that the acute care setting may be their first point of contact um, with health care in quite some time. Most older adults, when they come to the hospital, have more than one system failure, and they're a high surgical risk. They're at high risk for acute episodes of confusion related to their illness and the fact that they're in a different environment, so they're at high risk for delirium. And they again are at high risk for premature discharge. The length of stay, we're reimbursed right now based on DRGs. If the institute, older adults are typically, or not typically, older adults are frequently discharged a little bit prematurely, and again, that can precipitate the readmission process within 30 days. Uh, Most of our older adults will qualify for rehabilitative services upon discharge through Medicare. Environmental safety is a key um, area where nurses, if we're paying close attention to the environment where our older adult patients are in the hospital, we can improve the safety and prevent um, negative outcomes as a result of uh, unsafe situations in the environment. We need to address the fact that most older adults are using some type of assistive device, whether it's a hearing aid, glasses, a cane, a walker, a wheelchair, um, handrails in a bathroom or in a shower. Many older adults experience some type of depression and have sleep disorders. And we want to make sure that we're properly addressing and not overutilizing any restraints on the older adult. More than 35% of all prescription drugs are used by older adults. Um, Most patients, or on an average, patients or individuals 70 years of age or older take at least 7 different medications, leading to problems related to polypharmacy. Individuals older than 80 take up to 12 medications, or an average of 12 medications. That's different medications, including over the counter and prescription medications. That puts the individuals at risk for increased risk for ADRs, or adverse drug reactions. And we need to be aware that adverse drug reactions account for up to 12% of all hospital admissions. This next slide is from Lewis, and I encourage you to take a good look at it. We're going to spend some time next week talking about polypharmacy and addressing some of the specific problems related to medication administration, medication prescribing, etc., for the older adult population. The older adult, just by sheer nature of the aging process, experiences tremendous changes in how drugs are metabolized and cleared through their bodies. Individual older adults are very, very susceptible and very sensitive to psychoactive drugs. We need to make sure that any older adults who are considering putting on any psychoactive medications, that we start with very, very low doses and monitor the individual for effects. Circulatory wise, we need to be aware that the antihypertensives, for example, may cause severe dropping in blood pressure using dosages that might be appropriate for a younger adult. So we need to be cautious of the dosaging with our older adult population. And as nurses, we're not, unless you're an advanced nurse practitioner, you're not in a position to prescribe medication. But as always, we are assessing our medication orders for appropriateness, and we are educated to question dosages and medications that are ordered for our patients that we have questions about. The decreased functioning of our liver and our kidneys results in changes in the metabolism and excretion rates, and we know that age-related changes typically lengthen the half-life for renally excreted drugs. So drugs that are normally excreted through the kidneys may remain in our older adults' bloodstream a little bit longer and build up over time, and may even the older adult may even experience some negative or some toxic effects. The gastric emptying rate with the GI system in the older adult typically slows down. Gastric motility declines. So drugs that are absorbed through the GI tract may be absorbed less readily. In those cases, perhaps a different medication would be appropriate. It depends upon the individual adult. We also want to pay attention to the changes in body mass, the changes in total body water, so that when any of our older adults are on water-soluble drugs, for example, the table here, or the diagram here talks about digoxin, we need to realize that the dosage of digoxin might need to be a little bit lower as well. So just in general, there are some tremendous changes in how drugs are metabolized and excreted with the older adult, and we as nurses need to be aware of the side effects of our patients' medications, monitor dosages really carefully. Some of the common problems that older adults experience related to medication administration relate to their decline in cognition, some sensory issues, and some functional mobility issues. Some common causes of errors, medication errors by older adults themselves, include their poor eyesight. They have difficulty reading the labels. They forget to take their medication unless they have a really good system set up. And home health care can certainly be instrumental in assisting older adults in the home setting to have a system where they're less likely to forget to take their meds. Older adults use a lot of over-the-counter medications and may not report these to their health care provider. And we know that over-the-counter medications can very often react adversely with prescription meds. So it's important for us to take a look at all the types of medications that patients are taking. And a great, simple method for us to utilize is called the brown bag method. Ask your patient, when you come for your office visit this week, please bring all of your medications in a bag. Bring them to the office, and then the nurse can go through them and look and make sure there aren't duplicates, a generic and a trade name for the same drug, and the patient doesn't notice that. Make sure that the over-the-counter medications are being considered, as well as vitamins and herbs and other remedies. Poor finances for the older adult. Again, we talked a little bit about that in class. If they're just getting by each month and there are extra expenses one month, well, one of the first things that the older adult might not purchase would be their prescription refill for that month. Sometimes older adults may misunderstand instructions. They go for a physician office visit, the physician and the nurse tell the patient how they're expected to take the medication. Because of poor eyesight, they're relying on that verbal communication of how to take the medication. Maybe the older adult doesn't really understand properly the correct way to take the medication. So that's another common cause of medication error. Um, and then you have older adults who, like, well, I don't know if this pill is really going to help me anyway, and I don't like the side effects that I'm having with this medication, so I'm just not going to take it. So, those are some additional issues for the nursing staff to consider when assessing and interacting with the older adult and trying to come up with a good treatment plan. If you're planning a discharge for an older adult from the hospital and you're getting the feeling that this older adult isn't going to go home and take this medication, don't send that older adult home yet. Stop and see what other alternatives might be available, if there are any. Talk more with the patient. Try to get them to understand the value and the importance of taking the medication. Sometimes side effects go away after you've taken the medication for a week or two. But talk in detail about these kinds of issues with your patient.